professors know you, and many times that pre-med committee can really generate a lot of wonderful information for us about who you are, how you think in the classroom, how you follow up on assignments, your punctuality. All those things are very important. Those kind of characteristics that many times perhaps are looked at a little bit. As a physician, those are good characteristics. You know, it's okay to be a little anal as a physician. Okay? That's kind of a good thing. Okay? Now you can take it too far, and you have to be sure you've got the.
Are you pointing at me when you're saying you've taken
it too far? No, you'd be taking it right here if you take it too far. And you have to have an emotionality that is complementary to that anal approach. But I would want a doctor that's going to cover all the bases. And your professors many times glean those kind of information items by watching your coursework, by watching your attendance, by watching you follow directives.
If you finish your clinical experience and you cannot answer this question, you have not had enough clinical experience. Tell me about your favorite patient and what you learned from it. And I am surprised by the number of applicants that I ask what I think a relatively simple question and they struggle with that. Don't just check off the box, yes, I have clinical experience, and move on. Learn from it. I'm sorry.
You said that work ethic is also, if you have like an employer that you've been with for a while, are they someone that would also give you additional insight into that?
I think they can, and I understand that, and I think they will give that insight. I think many times that can be that extra letter, if you will. But again, we've got to look at that brain power, that processing, that synthesis, that ability to take complex issues and be able to handle them, in terms of the rigors of academia. I hear what you're saying, and I do think in certain cases they can generate a lot of those particular characteristics and validate them for us. So I'm not opposed to that. But they're not going to be able to talk about the other, generally, or that, because they're not dealing with it. So it has to be in concert with ensuring you have balance, and that those other letters of recommendation are really going to reflect that element of the whole LOR, letter of recommendation process. Does that make sense?
Well, you just put a plug in here. This is one of my pet peeves. You guys come to me and say, well, can I just have anybody write a letter? You need to have three, hopefully you guys will support this, at least 3 professors, 2 of which should be science professors and 1 maybe non-science. But if you could get 3 science professors, and what I have been told that the med schools want is something they want someone to write and support you as far as your academic ability. Is that?
I was trying to say that. I just think probably said it more eloquently than I did, but that's what I was trying to say. That's really a part. But I do think the characteristics of you, in terms of, let's say you got somebody that you were doing research with, that talked about your attention to detail, your attention to learn from your mistakes, your attention to be creative in the research environment. Those are wonderful characteristics that maybe an individual like that can address, that fit into what we see as a successful physician. I mean, you see, so I can't just say one size fits all, but I think you're getting a drift of kind of the importance of the LORs and the need to be sure you get someone who can accurately, adequately talk about you and address the issues that Dr. Smith mentioned.
I'll also say there's students that come and say, well, I don't have any professors I can ask to write a letter for me, so I get excused, right? No. If you can't get 3 or 4 or 5 people to write letters for you, and they are good letters, then that is a reflection on who you are as the applicant. So just be aware of that, and you tell me, well, Dr. Smith, I didn't get to know any of my professors. The other thing I hear is, well, I was such a good student, so I didn't get to interact. I didn't need to go and ask for help. I didn't get to see, I didn't need to see the professor. That doesn't, you don't get off the hook with that.
For freshmen and sophomores, you can see this is a wonderful example. As you're going through, you can now realize I need to be alert to this is coming down the pipe, so I need to be establishing some of these relationships as I go, because that doesn't just happen overnight. So once again, I applaud the younger ones being here to start hopefully taking what we're saying and start putting into action now, so that when you get to that level of application, these sort of things have been attended to.
I know it matters to DO schools, but does it matter to MD schools if you have a letter of recommendation from a DO? I know to apply to a DO school, you have to have an application or letter of recommendation from an osteopathic doctor. You can also have one from an MD, but it's mandatory, you have to have one from a DO. Does it matter from an allopathic standpoint?
You don't have to have a letter of recommendation from an MD.
Okay. But if you have to do that,
If you have somebody that fits all the stuff we talked about, that'd be great, but you don't have to. So that's how I'm answering the question, the way it's posed.
Couple questions over here.
Does it matter what kind of doctor we shadow?
Not really. No, it's a physician, once again, that in that shadowing process, you're able to respond like Dr. Catalano mentioned. Because it is tough many times to get those shadowing opportunities. And if you have a personal physician that will allow you to come and shadow him or her, and for a time being, then you need to take advantage of that. And even though you might have thought, I want to be a dermatologist, you're not going to be a dermatologist unless you get a medical school. So the real trick is to get a medical school. That's that medical experience. Then, if you were going to apply to dermatology residency, then they're going to want to know about what your experience might be in dermatology.
And remember also, we are not asking you to get clinical experience to decide what kind of doctor you want to be. We're asking you to get clinical experience to decide if you want to be some kind of doctor. Most of the time when you start medical school, you may very well think that you want to be the type of doctor that you happen to shadow. And most of the time that's going to change as you get used to it. So don't worry about certain numbers or certain types. We just want the experience so you can answer the questions that Dr. Stallman was mentioning.
My question was more for the interview process. How would you suggest that one prepares? I know some people suggest like going and taking mock interviews, but then sometimes the questions are repeated, so the answers seem like they're pre-planned and not that hard.
No, I think that's very true.
So,
I think that to back up a little bit, you want to come in, and the whole process, there is a preparation to the process. Just like I wouldn't say go take the MCAT cold. I would say prepare to take the MCAT. Get your study plan, get your idea, get it fit in. It's just to go take it cold. Not that you can't do it, but it's expensive. It just seems to me you ought to prepare. So I do think there are potentials for preparing for the interview. Second, you are going to be yourself, as Dr. Catalano mentioned. You're going to be honest. You're going to be yourself. You're not going to get into that. I think that he wants me to say this, so I'm going to think that he's thinking that I'm thinking that he's thinking this. So no. Don't get in because you'll get tripped up in a minute. So you want to be honest. You want to have the ability to communicate. You don't want short answers, but you don't want to be chatty-catty. You want to be able to give your, answer the question, and you want to be able to back it up, or will be asking questions that then allow you to go ahead and explain better the answer to your question. So that I think those are kind of the salient features to that. Now, then in that preparation, mock interviews are not bad, no. And you know yourself well enough and your nervousness or whatnot to say, I need that confidence that a mock interview will give me going into the real thing, okay? But I think your point's a very good one. You're not going to the mock interview to get the pat answers that then you're going to turn around and give me. The mock interview is a process under which you just have an experience to kind of maybe get a few of the bugs and the kinks worked out. I think that the interview does, many times, is going to, you got to know something about medicine. That's that preparation. Current events are important. Understanding what's going on in healthcare. Humorously, many times we'll say, how would you fix our healthcare system? Now, do you really think we think you got the answer to that? No. But we like to hear that you're able to be conversant about the healthcare system. That the honest answer is you don't know, but this is what I do know, and this is what I've read, or these are my concerns. You see what I'm saying? So I do think there are elements of an interview that talk about why you want to be a physician, what your experiences are, what your volunteerism is. Many times those are repeated in your personal statement. Current events, healthcare indicators, thinking through being able to respond to issues that might not be your best in your application. Generally that's going to come up. If you've had a situation where, because you have to disclose information. If you have a record, it's part of the application, it's disclosable, and what's that in law, what's that word? Discoverable. It's discoverable. so you have to do it. Well, then that's probably going to come up in the interview, and you're going to have to be prepared to respond to that. Once again, I just can't give you that pat answer, but are you kind of getting a flavor of the kind of things coming into an interview? Dr. Catalano, Dr. Thornhill may have additions to that.
Yep, just this really is not relevant to what you said, but it did remind me of something when Dr. Stallworth mentioned a discoverable incident. I might also take this time to caution you about what's on your Facebook page. Because remember that social networking sites can sometimes interfere with the type of presentation that you wish to make to your medical school interview. So you need to be careful. You are held to a higher standard. Whether you think that's fair or not, if you don't think it's fair, then you probably need to rethink your long-term career. But it is a privilege to be a physician. You will be told things that people won't tell anyone else. And you also need to maintain your sense of respect and dignity, and you do need to be careful.
Well, people need to leave because we're boring you, or because we've reached the limit of your being able to sit, feel comfortable leaving. That doesn't bother us. Like I say, we're here for you. So, and I know y'all have many other responsibilities, but we'll still go.
As long as we have questions and you guys want to stay, and these gentlemen are willing to stay. Now, I know that
there is a limit. We're driving back.
They're traveling back to Columbia tonight, so as long as you want to stay and ask questions and they're willing to answer, we'll continue to go.
I get to drive to Green.
You get to Green.
I get to drive to Columbia.
I have to be at work at 5 o'clock in the morning.
How would you suggest, like, dressing?
Okay, a very good question. Very good question. And let me even address that in the photo that you send. Think about what you have on in that photo. Okay? Because right or wrong, we will draw conclusions from that.
Or the background of the photo.
Or the background of the photo. That's right. And business attire is the quick answer. Okay? Guys, coat ties. Do you have to? No. But that is the traditional, respectful dress for a medical school interview. But you can wear a pantsuit, nice pantsuit for a woman, or now a man in a skirt might not work, but a pantsuit will work fine for a woman. But basic business.
But if they're Scottish and it's a kilt, it's okay.
That's right. Yes, we are culturally sensitive and diverse. So you can wear your kilt. Okay.
Well, one of them
You will
just
be interviewing the kilt. Okie dokie.
give Dr. Stallworth and Dr. Catalano a break here and kind of make some final comments. And then again, we're happy to stay around. So if you have other individual questions you want to come up and ask us, we'll do that as well. I just said, a psychiatrist, since I've kind of been listening to the questions and certainly the comments and trying to give some idea of what other